Hi, I'm Dr. Chris Pagnani. I'm an instructor at the Johns Hopkins Hospital. I supervise psychiatric residents at Jefferson Hospital, and I'm the medical director and founder of Rittenhouse Psychiatric Associates, which sees children, adolescents, and adults for psychiatric evaluations, medication management, and psychotherapy for in-office visits in Philadelphia, Pennsylvania, and in Paoli, Pennsylvania. And then once a patient has had an in-office visit, they can move to virtual visits for patients who live throughout Pennsylvania and New Jersey as well. I wanted to make this video just to discuss a new service that we're offering. And the reason for this is because one of the things that I've noticed over the last several years is that there really is still a lack of mental health provider availability in the Philadelphia area, throughout Pennsylvania, and really throughout the country. And what we've seen, and this is really wonderful, but we've seen an increase in primary care providers, OBGYNs, and other medical providers taking care of patients psychiatrically. And again, I think that that's actually really wonderful. And there are many incredible primary care providers and other providers that are helping us to take care of the mental well-being of the population. With that being said, we're also seeing an increase in online availability for patient appointments for mental health care. Some of these companies are also absolutely fantastic, and I want to commend those companies on doing an excellent job to increase availability for patients who really need psychiatric help. However, I have noticed that some companies and some providers will see patients for very short periods of time. For example, I've seen ads that say, hey, if you come in for do a 5-minute evaluation, then we'll put you on a subscription plan for a medication and we'll make a diagnosis. And I've heard from patients who left some of those programs that they were prescribed controlled medications or medications with high abuse or just whatever medication they asked for. I think about psychiatry as very different than that. So the idea that someone can do a 2 or a 5-minute psychiatric evaluation, make a correct diagnosis, and then know what medication to prescribe. To me, while that it may be possible, the people doing that must be some of the most brilliant individuals out there, because I need a lot more time to sort out what about a patient's symptoms are due to their any behaviors. What about their symptoms are due to their life history, their life story, any traumatic events from the past, their relationships, stressors, work, family, etc. What about their symptoms are actually made worse by their personality or by their temperament, or things that can be treated with therapy to help them? And then finally, is there actually a illness? Is there a mental health illness or disorder that we can treat through medication management? Life is very sticky, life is very complicated, and the idea that I could ever do a 2-minute evaluation and know what was going on for a patient, I just know that I'll never be that good. So the service that I'm providing is actually, instead of 5 or 10 or 15-minute psychiatric evaluations, I'm going to be setting aside 3 hours for one-time patient appointments. During those 3 hours, usually the evaluation itself takes about 2 hours, and then that gives me a third hour to write up a report. But if I need that full 3 hours with the patient face-to-face or virtually, I'm going to take it, and there'll be no additional charge, obviously, for me writing a report. But what I'm doing is a full, thorough psychiatric evaluation where I can really go through the patient's life story, talk about their personality, talk about their any behaviors that might be impacting their mental well-being, and then do a evaluation for any psychiatric illness. I'm then writing that report, writing up recommendations that I can give to their primary care provider, to their OBGYN, or to their other mental health specialists to help them in terms of next steps for caring for that patient long term. Some individuals who take advantage of this service are seeing me for that 2 to 3 hour initial evaluation, and then asking to follow up with another provider in our practice. Our practice is set up so that we all cover for ourselves, and we do not have on-call social workers or residents like some of the local hospitals do. And so we do have some screening criteria that patients need to meet in order for us to really feel that we can safely take care of patients long-term. But if a patient does meet our criteria for being a patient in our practice, and we feel that we can safely take care of them, that we have the resources and competencies to do so, then a patient will be transitioned to another provider within our practice. I'll have a conversation to collaborate and really discuss the patient's case with that new provider before they start. I'll send them that report, and then they continue with that provider long-term for their treatment, as long as that's appropriate. For other individuals, we're seeing psychiatrists, primary care providers, OBGYNs have referring patients over. I'm having them have this 3-hour evaluation, be sending the report, me calling them, discussing the case with them, and then providing next steps in terms of what to do. And it's I think helping them to have more confidence in terms of, all right, these are the best options for this patient, and how it can help them moving forward. So if you have any additional questions about this service, please feel free to reach out. You can call our main number, Amy, or one of our admin team. Amy's our office manager. We'll be happy to pick up the phone and discuss with you setting up this 3-hour evaluation.